The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today I'm happy to have Patty Barnes with us. Patty, welcome.
Thank you, Don.
So you are a certified midwife, right? Professional midwife, and you've delivered quite a few babies. How many is it now?
Over 750.
And today I think we're going to deliver another one today, so to speak, kind of hypothetically here.
Yes.
We have models and different things. I think it's going to be a great time. You have entitled this segment, or what we're talking about, When to Call for Help, right?
Right.
And I assume that has something to do with the signs of labor. What are the signs of labor?
Well, right before labor, most women have what they call lightning.
Not thunder, but lightning.
Yes.
And is that like talking about the heaviness or some feeling? Oh, so you're going to explain it. You have a graphic here. Okay.
Yes. This is mostly with the first-time mothers.
Okay.
The baby settles into the pelvis. It's usually about 2 to 4 weeks before labor.
And they'll
begins.
feel that.
Yes. And Braxton Hicks contractions increase more, and that's tightening of the uterus. Bloody show, which is a pinkish glob of mucus, as the cervix is dilating and starts thinning out.
And that's not a couple weeks before.
No, not always.
Okay.
Sometimes it can be, but
All right.
several soft bowel movements and a burst of energy. Now, every person can vary. Not everybody's alike. Again, the first mothers, when it's their first baby, you will see this more because you can almost tell when the baby's dropped.
Okay.
Okay?
So they'll feel that, they'll sense that. You know, I guess before I was born, my mother always tells me that she got this real burst of energy and she cleaned the entire house.
Yes, it's like a nesting syndrome.
Nesting syndrome.
But again, they'll say, well, you know, I feel like I can breathe again. Because the baby,
Watch
individuals
out
look
then,
at them,
huh?
their baby's dropped, and they feel, again, they'll feel pressure on their bladder. So the beginning of pregnancy, they have that pressure on the bladder. They have to urinate often. And then toward the end, when the baby drops, they'll feel pressure on the bladder. They'll have to urinate often again.
Did you bring any pictures to show us?
Yes, I did bring a picture to show you.
Okay.
This picture, the baby on the left is what we call engaged. So when the baby drops into engagement, then she will feel the pressure on the bladder.
That's the lightning.
Yes.
And next comes the thunder, or next comes the delivery. Okay. Wonderful. Well, you know, many times as a nurse working in a hospital, I'd work there at the front door, triage in the emergency room. People would come in that thought they were having a baby, and many times they weren't. Sometimes they were, many times they weren't. What are the true and false, or maybe the false and true signs of labor?
Okay, well, first of all, the false labor begins with, you know, usually have the irregular contractions.
So they're not just, if it's true, it's not irregular, it's just irregular, okay.
Right. And they won't intensify. In other words, they stay the same, they're not getting harder. There's no
Okay.
change. Contractions will rarely exceed 60 seconds, and they do not get closer together. Mostly felt in the front and high.
Okay. So up high.
Yes,
All
and
right.
not lower. And also, they may cease with position change or activity. Hot baths or sleep usually stops the contractions, and that's a good indication. And also, you usually do not lose the mucus plug. You may, but you may not. Most of the time you don't. And minimal cervical station, if the doctor or midwife checks your your cervix, and she would see no change.
Okay, for dilation or anything.
Yes.
So those are false signs. What about true signs?
Okay, with the true signs, we see that the contractions turn into being more regular, and they intensify. They'll get harder.
Mm-hmm.
And the contractions will exceed 30 and then 60 seconds and longer. They'll grow closer together, and not only will they feel it in the back, but also in the lower front.
Mm. So they really feel it just coming. Okay, anything else?
They will not cease with position change. Hot bath or sleep will not stop them. And that's a good indicator, like if they call me and tell me that they believe they're having true contractions, I will have them go take a warm bath and try to go to sleep. And if they cannot,
then you're on your way.
Yes.
Or they're on their way. Okay.
And of course, when I check them, the effacement and dilation will change.
Okay.
We can see that they're
Signs
sure
of-
enough they're starting to dilate.
Have there ever been any times when someone just has a baby without any of these true or false signs? No warning at all?
Well, it's rare. I have had a couple ladies that just they felt a little unusual, and their cervix starts changing, but then they would feel the heavy-duty contractions around 8 centimeters, and that's pretty rare. But then I've had only one. She was a little Amish lady that she never felt anything. It was the strangest thing. You just feel a little funny in her stomach. You know, she would say, I feel a little stomach and a little ache and a little crampy. And first of all, the first birth she had, she went to the doctor in the hospital, and she didn't make it in time. Her husband flagged down a police officer.
Oh, great.
And that was first delivery, which they're usually longer. The second one, I think she had it on the lawn or somewhere. She got a little closer to the hospital. But finally, the doctor said, we need to just keep her at home. And so we tried to get there. And she called me, and her husband called and said, she feels a little funny.
And you were
Said, I'm on
your
my
way.
way, I'm out the door. And I didn't get there in time. But the husband called back, and my husband answered the phone, and he said, what do I do? I see the baby's head. And my husband's, he should know, at least how to talk them through. But he got so nervous, he said, I'll pray for you, brother.
Oh, no. So did you get there in time that time?
No.
No. Well, I would have liked to talk to that policeman after. What do you mean? He flagged the policeman over and...
And police officers, they do not like to deliver babies. They really would prefer not to. But anyways, yes, he ended up delivering that baby also. So finally, the doctor said, we need to just train the husband what to do.
I can imagine. So the police officers don't like that. Maybe they would have given the lady a ticket for speeding or having her baby too fast, but not delivering the baby. In the hospital many times they have the ladies lay down and different things. I hear you talking about moving around. Is it okay, or is it good for ladies to be laying on their backs during delivery?
Well, we encourage being in the upright position. In Exodus 1:15 through 18, it talks about the Hebrew having their babies quicker and easier. And they were sitting on birthing stools.
Birthing stools.
And we do see once that they're sitting up in an upright position, they have their babies, opens their pelvis wider, and they have them quicker and easier. I brought a birthing stool with me.
So this is an actual birthing stool here, and I guess this is probably after the birth if this baby's on this. But maybe we should take the baby off, and then which way do they? I think it's pretty obvious which way they sit.
They sit on the birthing stool.
The back is right here, and they're.
We try to put some back support, pillows behind their back, and.
And this is up on the bed, or this is.
No, we cover the floor.
On the floor. Okay.
And it's like almost a squatting position, but with support.
I see.
And it opens their pelvis, and the reason why I end up getting this is because I notice that a lot of ladies, when they're at home, they like the upright position, and I have a hard time getting them out of the bathroom, and I didn't want to have any any babies on the toilet.
So you, so you, or in the toilet, one of the two.
Or in.
So this is, did your husband built this for you?
No, I bought this.
Okay. And so many of the babies then that you've delivered have been had, right? This has been the stool that they've used, and lots of the 700 and how many babies is it now?
Well, over 750.
750.
Yeah. Well, not all of them on the birthing stool, but a lot of them.
And the reason for that again is because that's a kind of a natural position to be pushing and all those different things.
Yes, the gravity is in their favor.
Gravity
is in their favor.
Yeah. Isn't that what they call it when you're pregnant? Gravid or something like that?
Gravita.
Gravita. That's a little different than this. This is actually the force of gravity. Well, you've written a book about some of this, haven't you?
Yes, it's the Ministry of Midwifery.
And didn't you just finish that recently?
Yes, I just finished it.
Oh, great. Well, we're looking. And are the things that we're talking about today, are they covered in that book?
Yes, that's all in the book.
Great. I know that some people are saying, I'm not going to be able to remember all that, but at least I'll have a resource. We're talking to Patty Barnes. She's a certified midwife, professional midwife, and she has a lot of wisdom from delivering 750 babies. And when we come back, we're going to actually walk through a birth and talk through it, and you're going to learn a lot of interesting things, and we hope that you can join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Patty Barnes. She's a certified professional midwife, and we're talking about home deliveries or deliveries, right? And tell us a little bit about delivery itself.
Okay. First of all, in a normal delivery, we have, before labor begins, we have what they call cardinal moves. As the baby moves down into the pelvis, it starts to rotate. And as you can see, the cervix is thinning, and the baby's head is starting to rotate internally.
Okay.
Okay, labor's continuing, and the cervix is starting to dilate. And the water, the amniotic fluid in front of the baby's head is bulging. And the baby continues to rotate until the head or the face is looking down at the rectum, because that's the normal position of the way the baby's supposed to come out.
And the water's broken at this point?
Yes, usually it is.
Okay.
Okay, this is crowning of the baby's head, and then when the head comes out beyond the pubic bone, it's looking down at the rectum, face down. And then it's externally needs to rotate for the shoulders to come through. This is the external rotation.
Okay.
And at that point in time, when the baby rotates that way, we check for cord, and then we suction the baby. And the anterior shoulder usually will come first, and then the posterior. And then, of course, after the baby comes out, then the expulsion of the placenta. The placenta will come out, and then the uterus will start contracting, going back to its normal size, which is called uterine involution.
So then it stops the bleeding and all those different kind of things. If
Yes.
it doesn't contract, you'd have problems with bleeding.
Right, we definitely would.
So these are called, what again, the cardinal moves?
As the baby comes down into the pelvis, it rotates. And the pelvis is greatly influenced in pregnancy There's,
What happens to it?
well, the hormone, progesterone and relaxin will cause the sacroiliac joints of the pelvis to be more flexible.
And show us where those joints you're talking about.
Okay.
Right here.
As the baby comes down, joints on either
right
side.
here. These joints in here.
The pelvis will open up like this.
Okay, so you're talking about these joints right here.
Yes. On
Okay.
each side. And the sacrum will move out of the way.
Okay, so like the sacrum here moves out of the way. That, like how again?
Will move
Okay.
out of the way. And then the last little coccyx joint will move out of the way.
Oh, okay.
The symphysis pubis joint here,
There in the front,
yes, that will,
relaxes as well.
yes,
Is
and
that
it
why
will
they
open
call
up.
it relaxin?
Yes.
So that's hormone
It's
relaxin?
it's not supposed to be this open, but this pelvis had too many babies.
Oh,
Supposed to be together a little more.
I see. So this normally happens. You don't have to take a medicine for this or anything. It just relaxes and it's doing it on
The
its
pelvis
own.
opens up as the baby comes down through the pelvis, opens up this way, and then the sacrum,
Okay.
and then the coccyx.
All right.
And it all moves out
Do
of the
that
way.
again.
Okay.
And point that towards the camera there in the
Okay.
middle. How would you do that again? It opens
Okay,
up
as the baby comes down, it opens up
that
this
way,
and then
this way.
sacrum, and then the last little joint here. Move
Okay.
Back out of the way.
Wonderful. Well, that's quite a. I take it you've done this before and shown this many times.
Yes.
This is your teaching pelvis. Okay. Great. Well, you've told me that you want to show me the entire process here of a delivery as
Okay.
well. And so we brought some different things here, and we have some time to work through this here.
Okay.
What's going to be best for me to do? You just tell me what to do here.
All right.
This is
Now, you've already delivered babies, remember?
right, yeah, but I've usually had most of the people here with me. You know,
Okay.
I haven't just had a pelvis. All right.
Well, as the baby's coming down,
Okay, let's turn it this way so everybody can see this.
Okay.
As the baby's coming down.
yes,
The baby's. This would be.
the best position,
Where's lightning?
okay, is when the baby is engaged. And
Right there. That's about the. That's where what you called a little bit earlier lightning, huh?
And as the baby's moving down into the pelvic cavity, begins to rotate, and the head will rotate internally as it starts to crown, to look down at the rectum,
Okay, so
Okay.
the back of the head's going to be what you see here.
Yes.
Crowning.
crowning.
Okay.
So the baby comes through the pelvis,
Through the pelvis. All
all
right.
right? And,
And this is all opening up.
yes,
And then it turns this way.
yes, but you don't,
I don't turn it.
no.
If I
but the-
turn it, that could be problems. Now, when it's coming out, do I check for anything as it's coming out?
Yes, you do. But as the baby, what I was going to say is if it doesn't rotate,
Yeah.
if it stays this way, it indicates to me that the baby could have what they call shoulder dystocia, or the shoulder stuck behind the pubic bone.
Okay,
Okay,
so
so
what do
the-
you do then?
Well, the baby always needs to rotate. In other words, rotate the shoulders this way so that the baby could come out.
Okay.
Okay, but if it doesn't, we do different maneuvers, like we'll turn the mother over on her hands and knees to open the pelvis up wider,
Oh, okay.
or we'll go in and in this way and get a hold underneath the armpit
push it.
and just try to rotate
Nudge it.
counterclockwise.
Now, is the shoulder this way so that it's right there where the pubic symphysis is, so it can open up? Is that why it's there?
Well, yes, it does open it up, but it needs to rotate sideways so that the anterior shoulder should come through first,
Okay.
and then the posterior. But at this point, you should be just supporting the baby's head.
Support. Okay. You tell me what to do.
Okay, support the baby's head. Immediately check for the cord around its neck.
Okay. And why do we do that? We're checking now for you're saying this cord.
Yes.
And it could be down there around
It could be. We've
And
had
what do you
many-
do if it is?
Well, we have several, and it's usually no problem. We just loosen it over the head or over the shoulders.
And push it back in.
And we just lift it up and let her push the baby right through.
Oh,
it's
okay.
no problem.
And if
But
you don't do that, what?
Well, if it's too tight and you cannot do that, then we just clamp in two places and cut in between. You know, clamp it off in two places and and then cut it off the baby's neck
Now you do that though only if
if it's too tight.
if it's too tight and if the baby's mouth's outside.
Oh, yes.
Yeah,
You know,
okay.
when it's out, you check, you could feel around the neck.
Okay.
And then you suction the baby at this point.
Okay, take this, and you told me that I need to push it in like this first, right?
Yes.
Not I have to do it first before instead of afterwards, or I'll get a big squirt. All right.
Suction
All right.
out the mouth and then the nose.
And the nose, too.
Yes.
All right. I'm suctioning the mouth and the nose. All right, I got it. All right.
Okay.
How'd I do?
All right, you did great.
I think so. All right.
Okay. Okay, now she's
Pushing
pushing.
down.
She's pushing the baby out. And, all right, at this point, you
How do I
catch the
hold it?
baby just like that.
Just like this?
And
When do I give it a spanking like they normally?
Well, you don't. You don't
don't
need
have
to.
to?
We don't. We usually it will come out crying, or you could stimulate it by rubbing
All
the
right.
back, massaging it.
Do I need to suction it again?
If it's mucousy, you could
Do
suction
you say
again.
it, or the little one, or how do you say it when you're
The little baby.
the little baby? Okay. And I suction again. Now, isn't it slippery with all that
Yes.
stuff on it? So I got to be careful.
Yes.
How do you usually hold it? Like this?
Yes.
Like that, okay. And I'm suctioning again. Oh, wait a minute, I'm supposed to do it like this. And then the nose again.
Right.
This baby has its eyes open being delivered. Is that normal?
Yes, that's normal.
Okay. And then what do I do? It's still hooked up there somehow.
Yes. Usually, I let the mother nurse the baby.
Okay.
If the cord stops pulsating, you can go ahead and clamp.
Okay, so
clamp it off.
you wait for the cord to stop pulsating. Let me ask about this cord. It looks like you have a blue cord in there and then a red cord. How many cords are there in there? How many vessels are there in
There's 3. There's 2 arteries and 1 vein.
there? Okay. All right, so then let me just have you hold
Okay,
this. I
I'll
know
hold
that
the baby.
And so I take this clamp. This is the clamp, right? And I
Right.
put it right there. I'm not going to clamp it because I probably won't be able to undo it.
Go ahead. You can clamp it.
I can clamp it? Well, thank you. All right there. And then I take one of these, I suppose, and I put it right here.
Yes.
Okay, and then I can clamp it.
You can clamp it.
And then let's just pretend these are scissors. Is this what I'm supposed to do?
Right. Cut right between.
And I cut right there.
Yes.
Okay, I cut. And
Take
let's
it
just
off.
pretend that we took that off. And then
Baby nurses.
baby nurses. Then what happens next?
Now you get a hold of the cord because you're
Got the
waiting
cord.
for the placenta to detach.
Okay, we're waiting for this, the placenta's this up here, to detach from the uterus.
The uterus. And as the baby nurses, it causes oxytocin to release, a natural oxytocin. And the oxytocin will encourage in contractions. And as the uterus contracts, starts bringing the uterus back down to size. It's called uterine involution. And it detaches the placenta from the uterine wall.
Okay.
Okay,
So actually
so-
the baby triggers that with, that's amazing, isn't it? Baby triggers that, okay.
Now, what we do is like a cord traction, wrap it around your finger.
Wrap it around the finger,
You know, like, have you ever
like
been fishing?
this. Okay.
Okay, just put some cord traction on it, pull
Okay.
it a little bit. Okay, and you could feel that it's tight, right?
Right.
Okay, well, as the uterus contracts and it releases, you'll feel it.
And I just
this
take
is-
up a little bit more slack there.
Yeah, you'll see that it, well, it's
Okay.
loosened, and you'll see a little gush of blood.
All right.
And then you will have her push it out.
Okay.
Okay, so
Push it
as
out.
she's pushing it out, what we do at this point, when you see the placenta, is I'll take and I'll twist it right here just to wrap the membranes
Okay.
as it's coming out, just to wrap the membranes all around the placenta, because I want to get every
Bit of it out.
bit of the placenta out. I don't want to
And
leave.
then once it comes out, do you check it to make sure it's all out?
Yes, I check every bit of it because I want to make sure I didn't even leave one little piece of placenta inside the uterus.
Now, I remember from nursing school they have 13 places. Is that right? Or no, maybe I'm wrong. What do you call I don't remember, but there's different places it's hooked in. And then do you check up as well in the uterus to make sure it's all out of there too, or do you just do it by checking the placenta?
Yes, well, we could see if
Right
everything's
here.
here.
Okay.
This is the maternal side of the placenta. This is
Okay.
the side that's attached to the mother.
All right.
And all these little pieces are called cotyledons, and they fit like a puzzle. And we can see that they're all there. And then on this side, this shiny side, this side is attached to the baby.
Okay.
Okay. And we make sure that the veins end before the edge of placenta, so we know that it's all there. Now, if the veins run off the edge, we can
Know that
know that
something
something's
ripped
left up
somewhere.
inside the uterus.
Okay.
Okay, and then we check the amniotic sac. This is what the baby was in. There's 2 layers of the amniotic sac, the amnion and the chorion. And we hold it up to see that it's all there. And
Because you don't want to leave any of that in there as well. You might have infection or something if it's left in there.
well, even just a little piece of membranes that's left in where the placenta site was could cause a major hemorrhage
Okay.
or even an infection.
So that's really important. The
Yes.
afterbirth is as important as the birth in
Yes.
terms of your work.
Yes.
So then what's happening with the baby right now? What do you do next with the baby?
Well, I let the baby nurse, and the parents bond with their baby. The most important thing is to make sure that the baby has good color and is nursing well, and the baby is warm. We
So you cover it up with a warm blanket.
We have a warm blanket. We have a warm cap we put on its head, and we make sure that the baby's not, or the mother's not bleeding also as well, and not a whole lot.
Okay, so then I've heard this expression used, APGAR scores. When do you do that?
Right when the baby's born.
And you have like a little chart or something?
Yeah.
What
It's
are you
1
checking
minute.
at?
It's 1 minute, and then at 5 minutes again.
What are you checking in the APGAR score?
We're checking the fetal heart tones, the respirations, the color of the baby. Is the baby well flexed, or is it limp? You know,
Do you let the dad in the room
do I let the dad in the room? I encourage the dad to help with delivery.
with the delivery? Is that why you had me do this? Okay. That's great. So, and then how long does this whole process normally take then?
The delivery itself, labor and delivery?
Not
or just
labor and delivery, but the delivery itself. When it starts coming down, the cardinal moves when they start.
Well, it's different for...
Different for different people.
Yeah. If it's your first baby, it could be, well, it could be 8, 16 hours.
Okay.
But then again, I've had some primeps or first-time mothers surprise me with 5-hour deliveries. Well, I'm
Just
talking
depends.
about labor and delivery. I'm sorry.
Just depends
The
on
pushing
person.
stage, just when the mother is pushing the baby out. For the first mother, it could take 2 to 4 hours.
Beautiful, isn't it? Every time you see this, it's a miracle for you. Is that right?
It's a miracle.
We've been talking with Patty Barnes. She's a certified professional midwife. She's delivered over 750 babies. She's written a new book entitled The Ministry of Midwifery. And really, it's a beautiful thing to see a new life come into the world and be a part of it. And it's wonderful to have people that know what they're doing, that can help us and help that little one have life right from the very beginning, that hopefully, as a result, will last for a lifetime.